Thank you, Mr. Chairman. I want to thank you again. This is our second bipartisan markup in as many weeks, and the fact that you're encouraging this type of work by this committee is to be applauded. I want to thank Ranking Member Brady, as well as all of my colleagues, for making this bipartisan effort on this most important issue that so many Americans are hungering for us to do something with. There's a lot more work that needs to be done, but working together, this hopefully will become a habit in this committee and throughout the entire Congress. This is a very complicated issue, but as President Trump, when discussing the pharmaceutical industry, said in January of 2017 before he took office, these guys are getting away with murder. That's a very simplistic way of looking at the fact that this is just so unfair to so many American people. We don't need to convince the American people that this is a problem. 80% of Americans believe that prescription drug prices are too high. And we learned during our hearing back in February 12th that America is the only country in the world other than New Zealand that permits pharmaceutical companies to advertise on television. Think about that. In the entire world, the only two countries in the world that can advertise on television are New Zealand and the United States of America. So it's not surprising that we also found out in our hearing that the pharmaceutical companies spend more money on marketing than they do on innovation and on R&D. And those TV commercials, as our colleague Brian Higgins pointed out, paint these very rosy pictures of sunshine and happiness and everything's wonderful and take this drug and everything's going to get better. And then what do they say? They say, go ask your doctor. So it was interesting to learn that pharmaceutical companies spend even more money marketing directly to doctors, taking them to lunch, buying lunch for the office, having conferences, going on cruises, having sales reps go to these offices and giving them incentives to use specific drugs, that they actually spend more money on this type of advertising than they do on advertising on television. This effort to provide more transparency will be a great step forward. There is so much more work to do, but if we keep on working in a bipartisan fashion, I hope that on this issue we can address a major concern of the American people, which is high prescription drug costs. Thank you, Mr. Chairman, and I yield back.
Thank you.